Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Varicose veins and spider veins doesn't exactly make for a wonderful dinner time topic, but that is what we are talking about tonight right here on Healthy Living Tuesday for your benefit, so that if you have varicose veins or spider veins, you can take care of them. And our good friend Dr. Yit Galan from Express Care is with us once again. Doctor, a whole bunch of questions from the Facebook community. Of course, everybody had a variety of concerns and everything. You ready to go?
Yes,
go ahead. Here we go. Question number one, gentlemen, if you would. Can a certain diet or food prevent varicose or spider veins, Dr. Lam? This comes from Ruth from Mongmong.
Well, Ruth, not really. A lot of this is hereditary and based on your exercise and lifestyle. One thing though, if you eat a lot of salty food, you will tend to get swollen lower extremities, lower legs, so maybe cutting back on your salty food. Some evidence shows that if you eat horse chestnut, which is a herb, you can buy it as a supplement, that it kind of helps your veins. I think that doesn't help very much, but you might try it. But in general, it's just a factor of heredity plus your lifestyle of trying to maintain your weight and getting a lot of exercise.
Okay, would it matter at all the manner in which you sleep? If you're always on your back, or if you're on your stomach or on your side?
No, it's the manner in which you live during the day. If you're like sitting all the time, if you can put your feet up, if you're not able to walk, at least if you're able to put your feet up and not sit all the time with the gravity pulling your blood down, that would be helpful.
Okay, question number two comes to us from down south in Agate. This is from Leslie R. Dr. Lam, Leslie, he or she asks, why are varicose and spider veins found mostly in women? So we go to the topic of gender selectivity, I guess.
And it's interesting. Well, a couple of factors there. The hormones that women have tend to relax the blood vessels more, so they will stretch and you'll be able to pull more blood lower down in your legs. So in general, women will have more problems with leg swelling and vein swelling, varicose veins. Another thing is that in our lifetimes, women will bear children and have large weight changes, meaning during your pregnancy you might gain 40, 50 pounds and not always shed it all. And as a result, you may be carrying more weight around, and that puts more pressure on that column of blood that's trying to make its way back up to your heart. And for that reason, many times women will develop varicose veins during their pregnancies and afterwards.
Okay. Question number three comes from Tricia, and Tricia is from the beautiful village of Jotnya. And Tricia asks, Dr. Lam, I hear there's a laser treatment for these nasty looking veins. Is this true? You kind of mentioned that earlier, and you even mentioned some more extreme procedures, you know, with the whole surgical and snipping one end and the other.
You're right. So there is something called endovascular laser, where they thread the little laser right into your blood vessel and then turn it on, and the heat of it will coagulate and basically cook the inside of that blood vessel and
burns it from the inside out.
Yeah. But then there are external lasers that you can go through the skin and zap the ones that are not that big. Very carefully, of course, not to burn the skin. That does work quite well. People always ask, do you need more than one treatment? And the answer to that is yes, because blood vessels always have many collaterals, many little rivers that go from that one main branch. So usually people need several sessions. Okay,
and laser technology's advanced
so much
by leaps and bounds in medicine and everything. Well, maybe we'll talk about that in a future episode. But as for now, talking about another type of technology and therapy, Dr. Lam, Pam from Sinahanya asks, what is sclerotherapy, and is it available locally?
Yes. So sclerotherapy is an injection into the blood vessel with an agent that basically causes the blood vessel again to constrict and scar. Sclerotherapy is a scarring therapy. So tiny little needles going in and making the blood clot and the blood vessel collapse so that there's no more vein. It sounds a little painful, and it is a little painful. Recovery from that is about 6 weeks for all the bruising to go away, but the results are very nice.
Okay, and our last question comes from Chris from Mangilau. And if our creative director, Jamil, can bring up this topic because he's really enjoying this episode, does medical insurance cover treatment and or procedures?
Oh, that's a great question. Okay, for the cosmetic side, no, but for the varicose veins that are medically necessary, yes, it will. And this is how you know. If you're having pain in your legs from the varicose veins, if you're having breakdown of your skin because the varicose veins are so bad that you're getting ulcers on your skin, yes. Basically, pain, swelling, or breakdown of skin, it should get covered by health insurance.
Okay, now we got about 30 more seconds and everything. Is there anything we didn't cover, or if people have questions about varicose veins, or if they think they may have varicose veins, you know, I've always kind of learned that if you go to like certain websites, you know, you can basically scare yourself into thinking the common cold, will
Yeah.
be the end of you.
Well, one thing that we always talk about with varicose veins is support hose. And people don't like to wear these on Guam because it's very hot, but it's a very, very effective treatment for both prevention and treatment of varicose veins. So if they run in your family, or if you're beginning to get them, or you're pregnant, you should pick up some support hose. And these are very tight stockings. You can purchase at the pharmacy usually, and they should travel all the way up past your knees, all the way to at least your thighs, to keep everything really nice and tight so your blood never has a chance to pool in your lower legs and you never get swelling, and hopefully prevent your veins.
Okay, and those compression stockings can be bought at like a local pharmacy or
Yeah,
the hospital?
or online.
Or online, okay. All right, well, doctor, thank you so much for your insight once again. Can't wait until next Tuesday when we do this
No
again.
problem. Thank